Hello, my name is Dr. Nelum Dharmapriya and I'm a GP and I work in Narangba, which is about 35 minutes north of Brisbane. And I was introduced to low carb just 14 months ago, and the first month was utter shock because I'm Sri Lankan, and if anybody knows what Sri Lankan food is like, it's very, very high in carbohydrate. So my initial thoughts were, what would I eat? How would I cope? How would I socialize with my family and friends? But then I realized that, nothing else had worked. So I'm going to give it a try. And it literally changed my life. I lost weight effortlessly. And, effortless weight loss is not a phrase I use lightly, because when else can you actually associate effortless weight loss in a postmenopausal woman? It's virtually impossible unless it's low carb, right? And I felt great, but most importantly, my attitude and my attitude to my medical practice changed completely. I've been a doctor for 27 years, and this information was like a revelation to me, and it made so much sense. And I knew that if I could just share a little bit of this knowledge with my patients, who, after all, were very much like me. They were women in their 40s, 50s, 60s who were overweight or obese, who were tired, didn't sleep, chronic pain, anxious, depressed, frustrated, that whatever they did didn't seem to make any lasting benefit. So I thought, right, I need to do this, but how? There's so much to say that wasn't said before. And how do I change the narrative? How do I undo all the brainwashing that I myself had been part of? So I realized that what I had to do was to teach what the hell is wrong. I love Robert Lustig. I don't know if any of you have read his book, Metabolical. I highly recommend that. So I decided I needed to teach the science. I needed to teach the science that actually underpins weight and health management. So I worked harder than I've worked in a very long time. I studied, I read, I listened, and in October last year, I came up with my metabolic health program that I run at Narangba Doctors. So this is an 8-session, one-to-one, in-person program, because that's what Medicare requires, and I cover all of these topics. So I do introduction to metabolic health. Why is it important? I talk about the different models of weight loss. I talk about insulin's crucial role in weight and health management, macronutrients and their effects on insulin, when to eat, so that's fasting, and I introduce that that's about 6 to 8 weeks into the program, because you need to be low carb for that time for it to actually work. Golden Rules of Eating Well, I borrowed this from Peter Bruckner, this title, chronic inflammation and gut microbiome, and finally stress, sleep and exercise. It's a very comprehensive program. Each appointment lasts 45 to 60 minutes, and patients usually come every 2 weeks, so it takes a good 4 to 5 months for them to complete the program. So, and the basic principles that I use are very simple. Whole food, prioritize protein, because I believe that will naturally take care of the carbohydrate, and not to fear fat. It's simple. So I'm presenting today the data that I've collected in the last year. So I've had 60 patients enroll in my program. I've excluded 2 groups. The first group, those that commenced the program in July, they haven't yet finished it. And the second group are those that only attended 1 or 2 sessions. So 26 completed 3 or more sessions, and out of that 14 completed most of the program, and that's what I'm presenting. So predominantly women, and the main reason for coming to see me was weight concerns. So my first a chart here is on weight loss. I mean, it's not the best metabolic marker, but that's what my patients are. That's what's important to my patients. And you can see here that, so the blue is the weight lost, and the orange is the weight loss percentage. And you can see that, they all lost weight. And so that's pretty good. They're happy. And then next one is waist measurement change in centimeters. And this is a much better metabolic marker because you lose the visceral fat, and you can see again majority of them had good reductions in their waist. And then finally, I'm going to just show you changes to fasting insulin levels. Blue again is the amount change, and orange is the amount change, insulin change percentage. And so we want the insulin levels to go down, and you can see that most patients, the insulin levels went down quite nicely. 2 of them didn't, but these, the starting insulins were very low. They were very metabolically healthy people, so I'm not too worried about that. All other metabolic markers improved, so the triglyceride HDL ratio improved, liver function tests improved, high sensitivity CRP improved. So, I'm pretty happy with this. And actually, so are my patients. So a few of my patients have given me permission to share their story, and a few before and after pictures. So in the red there is Karen, who has lost more than 21 kilograms, and she has gone from a size 20 to a size 14. She's very happy. And Jean here in the blue is a 65-year-old lady, and she says that she's the fittest and healthiest that she's been in her life. Now, Jean loves to go to the gym, and she recently achieved a personal best for leg press at 200 kilograms. And she says she beats all the young women. And then she also said she's always wondered if she would live to 100, and she now knows that she can. And then finally, I've got Kylie and Matt. Kylie lost a staggering 30 centimeters from her waist and completely changed her body shape. And Matt, he lost weight, he improved all his metabolic markers, and he's off all his medication. So, I mean, I'm happy, my patients are happy, it's great. But my program that I run at the clinic is very time consuming. It takes a lot of time for myself and my patients. And for my working population, it's not always feasible that they can come for this. So in an attempt to make the program or make this information more accessible to them, I got together with 2 amazing ladies, Nat Evans, who's a health coach who introduced me to low carb, and Deb Finucane, who's just standing there, who's a registered nurse who I've worked with for very many years. And we created Whole Food Revolution, and through Whole Food Revolution we run this, run a low carb for health and weight loss 1-day workshop. And so this is what we cover. So the idea is that we cover both the science and the lifestyle. We can't possibly cover the whole science because there's far too much. So we cover about 70%, and then we do the lifestyle. So we show people what kind of foods to eat, how to prepare them. We do a habits workshop, we do a comprehensive food label reading workshop, we do movement. It's very, very interactive. And we've run 2 so far, and the next one is actually next weekend. We sold out, we're very excited, and we've got lots more booked in for next year. So, and I'm just going to show you just a little clip. So it's a lot of fun. We all enjoy it. And we recommend follow-up programs. So we recommend that the attendees come every month for 3 months to see me afterwards, and that keeps them accountable. It gives them an opportunity to complete the metabolic health program, and it also gives me an opportunity to check how they're going, to fine-tune any issues that they might have. But what I've found is that those that don't come for follow-up, they fall off the wayside. Just knowing the information isn't enough for most people. They need that guidance. There was actually a paper published last year that showed exactly that follow-up is important for obesity interventions to work, and obesity interventions are more successful when they include a strong therapeutic relationship between patient and their GP, collaborative goal setting, and an individualized program. And I was very happy to find this because that's exactly what I've seen. So it's been an incredibly busy year for us, and I think next year is going to be a busy year because we've got lots of workshops planned. I'm also planning to offer my program as an online program through Zoom, and I'm also considering doing some kind of a course that patients can, kind of formulate a course that patients can access in their own time. So we'll see how it goes. Watch this space. I've also I've got an opportunity next year to teach or to talk to other GPs on cholesterol through the Brisbane North Primary Health Network. So I'm excited about that because I feel that it is crucial. GPs have an enormous role in getting this message out, and if we can share this information with other GPs, I think this is the way to do it. And actually, I've had a GP coming through into one of my workshops who's now doing his own thing with his patients. So it's been great. So if you want to know a little bit more about us, we've got a stand downstairs. It's Whole Food Revolution, and we don't have a website yet. It's coming next year because we're very new. But you can contact us on our email. And I just want to mention we have a very talented young lady who designed our icon, and if you see what it is, it's a smile with a stethoscope and a fork, and that's nutrition backed by science. So I want to say thank you to Georgie Conlon who did that for us. So that's my talk, and I really want to say thank you for giving me this opportunity, particularly in view of the fact that I'm so new to this low-carb world. It's been an honor and a privilege. Thank you.